sick kid. So, oh.
Wow, is there a glitch in the matrix?
I just I had our live stream. I got the live stream working, and that was, you could see the delay. So
So are we supposed to ask for public comments before we start?
well, the announcements part is usually what's considered the public comment.
Oh, okay.
Yeah.
All right.
So, okay, well, we don't have 6 voting members yet. So, and I've had 2 members say they're picking up sick kids from school. So,
Well, should we get going anyway?
yeah, probably at this point. It's 12:05, and hopefully somebody else will join us, and then we can go back and approve the minutes. So,
Well, welcome all. Should we do quick introductions? I'll just go down the Hollywood squares.
Okay.
Tom,
Tom Kuhn, PHAB coordinator.
Charity,
Charity Ludwig, board member.
Tammy,
Tammy Pike, Assistant Director of Health Services for Bend Pine Schools and board member.
Colleen,
Hi, Colleen Sinsky, Vice Chair, and I want to apologize that I have a cage full of baby chicks next to me. We have a small house, and I wasn't expecting the weather to be this bad by the time they were this size. So I'm going to try to keep myself on mute.
Aaron.
I kind of want to hear them.
Yeah.
Yeah, Erin Fitzpatrick, Director of Quality Improvement, Lapine Community Health Center.
And Commissioner Chang.
Hey everyone, Phil Chang, Deschutes County Commissioner, liaison to the PHAB, having some internet difficulties right now.
And I'm Rob Ross. I'm the Director of Education and Research for St. Charles and Chair. Welcome everyone. Well, we don't have a quorum, so we can approve the January minutes. Any announcements or updates from anyone?
Tom, did you know that you're sharing the live streaming guide?
Oh, I am. Okay. Yeah. That's weird. Well, now you see what I have to do for live streaming. Okay, let me try that again. All right, how about now?
Perfect.
Okay.
So any updates or announcements?
And I'm realizing our scribe is not here.
Uh-oh.
The meeting is being recorded, I guess, so I'm gonna have to quick.
Well,
Weather related. Commissioner Chang, you had your hand up?
I would just say that the legislature is almost done with this short session, and there's a lot of health related things to be tracking, but the 2 really big pieces of legislation that they were working on this session, it looks like the dust is settling, and it's pretty clear what those are going to look like at this point. And package is going to include some really substantial investments in behavioral health, addiction treatment capacity, as well as, kind of they're hoping law enforcement, criminal justice channels to basically kind of drive people into treatment. So there's that, and then the housing package that is coming through the legislature is going to include some significant investments to maintain homelessness services that are currently being offered in our communities. So continued operation for shelters and things like that. So those are the most significant health aspects, I think, of those two really big pieces that are coming out of the legislature.
Cool.
Yeah, thanks for sharing that. Okay, I also had a couple things. It's been for public health specific, slower session, which is generally the case in the short sessions. We always have our big funding bills going on in the large sessions. And I was just going to quickly share some of the bills I'd been tracking, although we've only done advocacy, or I've only requested advocacy from the commissioners with one bill so far this session, because most of the bills we're watching are moving through pretty easily and unopposed. So haven't had the need to make any special efforts for a lot of them. So I'll just kind of share my screen here just to show you some of the things I've been tracking. I shared some of these at the last meeting. I know Commissioner Chang knows a little bit about House Bill 4002, which is the general fund payments for substance use disorder treatment. And the reason I'm bringing this up was there's supposed to be a carve out for prevention funding for public health. And it turned out there was no funding for public health in this one. So we were kind of disappointed there was no funds coming directly our way. That was kind of a hope for public health specific prevention. So anyways, it did pass out of the Senate. And then House Bill 4081, which is emergency medical system modernization, very similar to public health modernization. And that basically is really the groundwork for creating some infrastructure for the state's EMS system, which is really in great need of organization and staffing and many things. And hopefully that'll trickle down to the local level. I'm our county ambulance service area administrator, so that's why this one is of relevance to me, because I've seen some of the struggles that EMS has locally and especially in rural areas. So that one's looking to move along fine. A local bill many of you might have heard about is House Bill 4103. It's the e-bike bill. Representative Levy was the big sponsor of this bill, moving it forward. It's also known as Trenton's Law. And that's because a local child was killed here in Bend that was riding an e-bike. They were only 15. And so this law will put regulations for riders that are 16 and under. So it's a good start, because we don't want like 15, 14-year-olds riding bikes that can go over 20 miles an hour and so forth. So as I'm sure all have observed when you're driving around. House Bill 4003 is just to establish a study group to figure out how to get more medical examiners in Oregon. This is not a big issue in Deschutes County specifically. We do have a good medical examiner relationship, but in many areas like rural areas, this is a problem. So we were just kind of keeping our eyes on this, but this one is moving along, no problem. And then the final one, House Bill 4003, healthcare licensure, establishes a task force on health professional licensing modernization in Oregon. So basically what this is going to do is help make it so that when an out-of-state employee is hired, that they can begin practicing more quickly than sometimes taking, as long as possibly a year to be licensed in Oregon. So this will kind of help it when we do get some people from out of state and situations like that to be able to practice sooner. So those were some of the main ones I was tracking. They're all looking to be moving through just fine. And, anything can happen between now and the end of the week. So maybe next week the situation is different, but we should know a little bit more by next week on some of these bills. So
Thanks.
anyways, any questions? As I said, we'll have a much more robust legislative process next year with the big session, and more need for advocacy from PHAB and the commissioners next year as well.
So were there any details about access to medication assisted treatment? Because one of the things is the access to psychiatry and addiction trained people, you know, which we are attempting to double the graduates for psychiatry here with no state funding. But do either of you, Commissioner Chang or Tom, know anything about that, or is that too far in the weeds? Or
Well, do you know what bill number that would be?
no, I was just interested in the first one that Bill had alluded to.
There in the package. So Tom described there was basically the policy bill, and then there's a separate funding bill.
Okay.
So the 4002 is the policy bill, and I can't remember what the funding bill's number was. But I for the life of me, I can't remember what it said.
Mm-hmm.
I just there was definitely
Commissioner, you're cracking up, so maybe if you turn off your video, the audio might come through a little better. Thanks.
yeah. Sorry, I it just froze for a chunk there, so I don't know what I missed. But what I was saying is there are provisions for medicated treatment somewhere in those two bills.
Okay.
Yeah, I think I have a document.
Can't remember the specifics. I'm sorry.
Yeah, I think
That's
I have a
fine.
document that maybe is where some of the investments are going. I don't know if it would be in here. It's a lot of behavioral health. There is funding for education. Not sure if any of these would cover what you're talking about specifically. But I can share this document with you to look through.
Yeah, you can just send it to me afterwards. I suspect it's not in here directly because we were thinking about focusing the lobbying efforts from Central Oregon with OHSU for next year during the long session.
Mm-hmm. Well, there is this funding for Oregon Department of Education, 1.99 million. So I don't know if that maybe, but I don't know. Not very specific.
Yeah.
Okay. All right. Well, I'll be sure to share that document with you to look over. But yeah, more to we should know, like I said, more next week. So
Okay. Thank you.
yeah. So I'm actually on the agenda next.
Yes.
And I had sent out with the agenda minutes this past week, kind of a recap of the environmental health fees that we were proposing. So I was just going to kind of run through that with all of you and just trying to get some feedback, and would be requesting a letter of support for fee increases from PHAB if that's what you decide. Oh, Commissioner Chang said the funding bill was House Bill 5204.
Okay, thanks.
Yeah. Yeah, these bills have been, it's been really crazy trying to track what bill number is what. We've had great difficulty keeping on top of that stuff. So 5204. Okay, well, I was just going to share my screen again. Hopefully this goes, okay. So basically, I had sent this out, as I said, with the minutes and the agenda. And just for PHAB to review, 3 sets of options for both mobile food units and travelers accommodations. As we are looking to present this to the commissioners in the next few weeks for the FY25 year. And these are just some ways we can generate some extra revenue within the program. And in which case we wouldn't need to quite as much transient room tax or general fund. As we will have an ask, I'm sure, for that. I just don't know the amount quite yet. We should know that, but this would help offset some of our funding. Colleen, Colleen, you have your hand raised.
Yeah, just a point of
Yeah.
clarification. I forgot what the class 1, class 2, class 3, what each of those means.
Sure. Let me go to so as you can see, class 1 and 2, we have 6 right now and operating out of 268 in the county. So it's a very small amount. Like the lower the class, the lower the risk. What they're doing, like class 1 is basically somebody who's selling packaged foods. Class 2 is one where maybe they have packaged foods and then also have ice for drinks. Strangely, we only have 1 in the entire county with that. But then class 3 is where it gets a little more complicated because they are controlling temperatures of foods, but they're not cooking raw foods. And then class 4 is where it's a full kitchen, like basically like any restaurant that cooks meat and so forth from scratch. So that's kind of the division between the 4.
Great, thank you. And then maybe you'll answer this at some point, but I was just curious if you have a number for the budget gap that you're facing. Like, I know we talked last time about the staffing shortage, or just like the number of inspections required by a staff person. And I was just curious to hear if, as you're talking about the rest of everything, if there's a number you're hoping to fill in the upcoming budget.
No, that's actually what I was referring to about not knowing how much transient room tax funding support or general funds we may need. We haven't calculated that yet. I will know in the next couple weeks because we're providing final revenue projections to our fiscal officer. Actually, today I'm sending her an update on that. So that is coming, and we'll have a better sense after I send her that what the gap may be. So anyways, option 1 is just to keep the fees the same as all the other fees. We generally go by consumer price index to determine fees, and it is approximately 4%. So you can see that is a very minimal increase for us, and only provides an extra $6,000 for mobile units. So does not give us a whole lot of extra revenue coming in. The second option is a variable increase, higher increases with 10%, 10%, 15%, and 20%. And we did have higher percentages for the class 3s and 4s because the time involved with inspecting them is much larger than class 1s and 2s. So that was kind of the rationale behind it. In this scenario, as you see, we still are not one of the highest in the state for mobile units, even though we have such a huge number of mobile units in our county. That only puts us ahead of one other county just by doing this increase, but does provide an extra $26,000. And then option 3 is a steeper variable increase. This puts us ahead of 2 counties. Still would put us, that would make us the 5th highest fees for mobile units. And this would provide an extra $38,000. So, you know, the percentages seem large, but, you know, like for the class 3s, 20% increase, that works out to only $100 for an entire year. So if you look at it that way, it's not quite as significant as the percentage may seem. So anyways, I'll just keep moving along here. And then just a summary of what we were going to present to the commissioners of the 3 different options. And just to show how much revenue when compared with each other. These were 2 areas where we thought the fees could go for a little bit steeper of an increase based on where we compare with other counties. We decided with restaurants, we are not going to ask for anything but the standard consumer price index increase. So that will stay the same because we are very high with regular restaurants. Any questions with the mobile food units?
What was the last thing you said were with regular restaurants where we,
Brick and mortar restaurants, so just like any building, you know, that's a restaurant.
Yeah.
We're very high with those fees. We're actually, per my calculation, we're the top in the state for those.
okay, thank you.
So we're not going to look at anything extra for those in particular. So. Anyways, moving on, this is one area that's new that I just brushed on lightly. And the more we looked at it, the thought this is a place where we could definitely do some much larger fee increases possibly. Travelers accommodations, we call them tourist facilities. There's many names we call them. This just shows how they're broken down by number of rooms. And that's how we charge the fees. And so there are 5 different categories of rooms, and we have a total of 81 last we checked in the county. That can change though. I will update these numbers before we go to the commissioners because, you know, in the next week, another hotel may open or something. So I'll try to get those as current as possible. This just shows us that with just the standard CPI increase, we're still very low compared to other comparable counties. And what hotels are charged, and especially with Deschutes County being such a big tourist area. You know, this is one area we felt like we should really look at upping our fees more. And also the other thing is, if you look here, a 1 to 25 unit hotel currently is $304 a year, and a 100+ room mega hotel is $386. So only $84 that a giant hotel pays more for a license than a little hotel. And so we thought we needed to make a little bit more of a gap there because there is a lot more work involved with a bigger hotel because we're supposed to inspect 10% of the total number of rooms. So for a 1 to 25 unit hotel, we would inspect 3 rooms usually, or 2 rooms depending. But for a 100 unit hotel, we'd be inspecting 10 or more rooms, depending on how many they have. So quite a bit more work for those bigger hotels. Option 2 is a variable increase with much steeper percentage increases. And as you see here, we did really put the percentages much higher for the bigger hotels versus the smaller ones. And so that would kind of push us up to about number 5 in the state for these fees. And then option 3, a variable increase with much steeper amounts. And once again, with the highest percentages going to the bigger hotels. And we're still in the number 5 rank with this even higher increase. And this would bring in an extra $14,000. So not a significant amount of additional revenue, but still definitely helpful and not putting us too high on the list for this exercise, and also making the gap between the really big hotels and the smaller hotels and what they pay a little more significant. So once again, there's some other scenarios of the additional revenue that this would bring in. So it's just, once again, it's just a way to help us cover our gap that we most likely will have for environmental health. And then so that ended the slides. Basically, we would go to the commissioners and present this information to them. And then they would have the option of proceeding however they think is best for the county. So I guess they may ask us if we're leaning towards one of the higher fee amounts. And I guess I would have to discuss with my supervisor what his thoughts are. We hate to increase the fees too much, but the tourist accommodation seems like there's a lot of justification for a steeper increase for sure. Anyways, any questions? I know that's a lot to take in.
So, Tom, I think you related to us that the accommodation increase wasn't a guaranteed increase towards looking after the food and beverage licensing, or am I incorrect?
Could you, I don't think I'm tracking.
Oh, so I think last time we were talking about the accommodation fee increases. Is that a guaranteed transfer to licensing? Or do other people vie for that money?
Well, I mean, I guess, I'm sorry, I'm still not quite tracking what you're asking.
So if we increase the accommodation fees for the larger hotels, that all goes towards the inspections and licensing, that's guaranteed?
Yes, that
Okay.
it's just we are charging for those right now. That goes into our budget. And I just made projections for the mobile units and for tourist facilities, how many more dollars that would produce for us if we raised it. And it all goes into our general environmental health budget.
Okay.
So I think that's what you're asking.
Yep.
Okay. So yeah, it all goes in to support environmental health, and the more revenue we bring in, then the less dependency we have on transient room tax, which is what is used to offset our gaps that we have, because we don't bring in enough revenue to completely pay for the entire program.
All right. It was the transient room tax that I was thinking about. Okay.
Yeah, that helps offset that. So we used to receive general funds, and then a few years ago, the commissioners made a policy decision to instead provide transient room tax because it kind of aligned better with what we were doing already, because we do so much work in the tourism industry. So it just seemed like it made the most sense.
Right.
I think Colleen asked this and you just, alluded to it, but like, do we know like what the gap is from this to what it would be? So this was a fully funded.
Oh, it would be the amount we'd have to increase fees would be very enormous to where we wouldn't feel good about doing it. So for us to keep our staffing level where it's at so we can provide good quality service, that's why we need the the TRT funding to help offset that, because that helps keeping our staff level high for the amount of inspections each person has to do in a year.
And when would you need a letter of support from PHAB? When does this?
Probably in the next 2.5 weeks. And that's something I would ghostwrite, of course, a draft to start with. And then, and the recommendation could just be that you see the need for a fee increase and not necessarily selecting one of the options specifically. So this is the first time we've done something like this. So this is kind of testing how we can have PHAB's advocacy for something of this nature. So. Commissioner Chang.
If I could also just say, that earlier question about, well, how much would it, how high would the fees have to be to fully cover our costs? The other thing to be mindful of is, even with the current level of funding, um, the inspectors are carrying inspection loads, workloads that are way out of the norm for their peers around the state. So, each of our inspectors is carrying, like, I think in some cases like 100 more, 100 more inspections per year than their colleagues, in other counties. So we already have people who are overloaded, and then the fees we charge don't cover nearly the costs of even that understaffed division. And we've been putting a little bit of transient room tax revenue into those into the environmental health division, but those dollars are getting tighter and tighter. This is probably going to be the second year in a row where we forecasted more transient room tax revenue than is actually going to come in. So I don't think we can count on transient room tax revenue coming through to kind of fill the gap as much as we have in the past. So that it's kind of it's a tough situation. And what's going to make it tricky, I would like to see I would be in line with a recommendation to raise the fees significantly, kind of the third option, probably in both of these cases. But at the same time, my two fellow commissioners are going to, and this is reasonable. They're going to express a lot of sympathy for businesses who are having a tough time making it as is, and are going to have additional fees placed on them. I would say, charging a food truck $100 a year more isn't probably going to make or break them. As charging a big hotel, a couple $100 more per year isn't probably going to make or break them. But my fellow commissioners, they do try to be very, very sensitive to kind of the viability of local businesses and kind of their ability to survive. So that's kind of the other perspective on this.
Mm-hmm. Yeah, and I just wanted to add, we also, do feel for the businesses as well. We'd rather we didn't have to propose higher fees, but because of the cost of the staffing we have and the volume of inspections the staff have to do, this is kind of, just some options we need to consider for sure.
Question.
Yeah.
So one or two questions actually. So one, is this like what environmental health does? Is that something that's like mandated from public health? And two, like across the state, is it normal that the fees don't cover the cost to provide what's necessary, that it takes funding coming from someplace else?
Yeah, to answer the second question, every county, and this is in public health, we found every county in the state does it differently. There's no real consistency between how they charge their fees. I mean, when I collect these fees in these tables, I have to go to their websites and download each fee schedule because there's not even a uniform database that has them all listed from across the state. So it's kind of a little scattered all over the place. I'm sorry, can you repeat the first part of your question?
I just didn't know if this was like the duties that you're outlining for environmental health, is that mandated by like public health to complete these for these business types?
Yes, this is all these fees are fees that every county charges, and they are mandated if by local public health. And the only way local public health wouldn't have to do it is if the county gave up its local public health services altogether. And there are a couple counties in the state that did give it up and gave it back to Oregon Health Authority to administer. But then the capacity and staffing is even less when the state is responsible. So.
Well, and the other thing that the commissioner brought up is that,
And Tom, this is a
sorry, go ahead.
Oh, I was just going to say, Tom, this is a state mandated service. These inspections are mandated by the state to protect the public health.
Yes, like communicable disease, access to immunizations, and many of our core services are required, not optional services. Yeah. Now the staffing level, there are standards for staffing, but not always is everyone able to meet those. Most of the time, it's difficult to meet that. Like the FDA recommends 280 to 320 inspections per inspector FTE per year. And our inspectors have been doing around 500 for quite a while. Don't get me wrong, 300 is, I think, a little bit of a lower number, but that is the FDA standard. So we are definitely well above what the FDA recommends per FTE for inspectors. And some counties don't get general fund. That was another part of your question as well. So we're very fortunate here in Deschutes that we get this support.
Well, and I was going to bring up the fact that the last time we talked about this, you gave us the FDA standards, and we were way below that, as is probably, or way above the number of inspections, as is most other places in the state. So, I mean, my personal feeling is that we should try to raise the fees according to plan number 3, but we don't have a quorum here, so.
I can circle back with that. And by the time I circle back, I might know what the gap is as well, what we need to cover. So that might be some helpful information to have as well.
Yeah. So would it be acceptable to everyone if Tom circled back and asked for a vote from folks, or?
I could do like a poll, like a survey monkey,
yeah.
like that.
And then wrote a letter of support.
Yeah, that plan sounds good to me. I was just I had a couple other questions come up.
Sure.
When I was just looking at Multnomah County and saw that a 6% increase proposed was shot down in 2023, and it looked like there was like a lot of lobbying and public attention from the Oregon Restaurant Lodging Association and others around just a 6% fee increase proposal. But what their public health responded to the media with, which I thought was a compelling argument, was saying like, well, since this was shut down, we're just going to have to ask for this amount from the general fund, ask for $1 million from the county general fund. So I think, to me, a compelling argument also in favor of striving towards the maximum increases proposed would be that, like, this is the full budget we need to operate fully in accordance with the state required staffing level or the state median staffing level. This is our current revenue and our current gap, and this is our projected revenue and projected gap. Here are the options we have to fill this gap. It's either going to come from county general funds or this much from each food cart pod, or from each food cart. And I'd be interested to know what percentage of, say, like the median profit is that increase? Like, is that $100 increase 0.0001% of the median profit we see from food carts, or is it like a much bigger percentage? So I think there are some data points that I'd be really interested to see as well as making a whole bunch of points here. I was just writing notes. If it's possible to propose a multi-year fee increase schedule, or if that's taking on a whole lot right now to try to look at multi-year.
Well, multi-year, we've never done that because every year is so different that we try to just adapt to whatever the situation is based on each year. We did last year, we increased all our fees 10% across the board. So just for reference, that's what the fee increase was then at that time. And your question about the median income, that I'm not sure if we could come up with that number or not. So, Commissioner Chang.
If I could just add that we're not really allowed to budget. During this budget year, we're not really allowed to make decisions about next budget year. So I mean, you could kind of put out a plan, but we couldn't commit to it. Like the decision for next year in that plan would still need to be made next year.
Yeah. Yeah, great point. I'm glad you you brought that up. Yes. So, yeah, collecting, the thing is, it's collecting the data on the licensed facilities can be very difficult, and there's not really a uniform established database or system in place that could really hone in on that. And the other thing too is, like, a food cart opens and then shuts down in 2 months, or there's been one that's been around forever and then they just close up and we don't even know until we go there that they're even closed half the time. So, it's very variable. Any day I can look in our system and there could be different numbers of food carts, restaurants, hotels. It changes very fluidly. So much of these numbers I'm presenting are more approximations than exact amounts.
Yeah, that makes a lot of sense. I think it was really compelling at the last meeting when you mentioned the staffing shortage and the caseload that each of the inspectors has to carry.
Yeah.
So I think showing the options, as well as like this budget is going to have to get filled somehow, whether it's through county general fund or this fee revenue, could be worth bringing into the presentation.
Yeah, we definitely will be doing that. That was the one thing we didn't have the information on yet when we presented to PHAB, but that will be included in our presentation. So,
is there any data points on like unintended consequences? So like if you have, larger cases, then do you see like a more of an impact or outbreaks or something like that then do you understand what I'm trying to say? I'm just like,
yeah.
is there something that happens based off of that may hit another department or something else to try to show the like preventative component?
Yeah, I'm sure there's some data out there on that. I don't have that with me right now, but that's not a bad idea to just have something like that in our back pocket, because I'm sure there has been a study done at some point to examine that. But yes, definitely if we're out in the field less, I'm sure there is data to show that there are at times increased foodborne illness. Commissioner Chang.
You could, following this line of thought, I'm guessing there are some real horror stories to be gathered from other communities about foodborne illness and inadequate inspections, and that might be a really good thing to include in this package of information.
Yeah.
Yes, I'm writing that down. That is a good one to have.
You could pick cruise ships. I'm sure they're never inspected.
Yeah.
I don't want to resort to fear tactics, but
Right.
I mean, I think it's a really legitimate point. Why do we even have this whole inspection system? It's to keep people from getting sick. And I'm guessing that there are stories and data that help us understand how this inspection system really does help keep people from getting sick.
Well,
But sometimes it takes a good story to kind of hammer that home.
Well, and I think that that's where it shows value. And then like, there's likely something from like the impact to the healthcare system, too. It's not just specifically, yeah, so like it's systemic.
Yeah. And one thing I guess that is something that we do based on when people get sick is they make a complaint to us. We go up and follow up on that complaint. And often when we go to that restaurant, we will find a problem that possibly contributed to the sickness, and then we're able to correct it. So that's one piece that we definitely do all the time, that we could speak firsthand about how we do it that way, but not necessarily with that, not that we've conducted a study on it, but yeah, we definitely do make corrections, and that's the thing, we are trying to provide good customer service to the restaurants and the owners or the hotel owners, so that they have less illness as well, and that actually decreases their liability for getting sued.
Yeah, yeah. Tom, when you have to do a follow-up, like, you know, like an investigation like that, do you charge the inspected party at all as part of, as part of that, complaint-based inspection?
Yeah, we do if we have to do another re-inspection because the problem didn't get corrected. We usually allow like the follow-up visit, but then if the problem's not corrected and we have to come back again, then we have to charge for a re-inspection because they didn't correct the problem.
But if you just, if someone pays their annual fee and gets inspected once a year, but then there's a complaint and you go and you check it out, you don't charge them another fee just to check on the complaint.
No, not just to check on the complaint. It's just if we have to come back again in regards to it for that. So, because the complaints are just very random that we get coming in.
Right.
So, it's, some places never get complaints, and then some places get them fairly regularly, but then it's just kind of all over the board.
Right. Well, that would be another thing to kind of explain, to kind of explain when you're saying, well, okay, the inspection fee is $650. What do you get for that? You don't just get the one-time inspection, you get, if anything happens, you get a follow-up inspection, as part of that fee. And then it's only if you have to come back a third time that you charge them again.
Yeah,
So,
yeah, I'll make sure I have all the fee schedule amounts ready to go in case we have to come back multiple times and things like that. Okay, yeah, good point.
But yeah, I mean, saying that basically you get one inspection and a possible follow-up if needed for your one-time fee, your one-time annual fee.
Yeah, actually the restaurants do all get two a year.
Oh, okay.
So that's even a better argument.
So you get two, and then maybe possibly a third, possibly a follow-up if needed.
Yes, thank you. I appreciate these thought ideas. Hey.
All right, well, Lauren's here, I think, right?
Yes. Yes, Lauren. And so Lauren is going to just give us a little update on the Shared Future Coalition. And if anybody else has any questions about the fee info, please send me an email. I'd be happy to chat with you more about it and provide you any other information you might like. So great discussion. Thank you. So Lauren is from our prevention team, and she's here to talk a little bit about the Shared Future Coalition. Also just kind of give an update on some of her program areas work that would be of interest to you. So
absolutely. I'm hoping to share a few slides, so let me
okay,
pull that up really quickly here. And I see a couple familiar faces, so I'm hoping that if there's some repetition, it isn't too heavy for a few of you. Let me go ahead and pull this up. Can you see my slides here?
yes.
Perfect. All right. Well, as Tom mentioned, I'm Lauren Wood. I'm a community health strategist with our prevention team with Deschutes County. And I wanted to come today to share a little bit about our community coalition. The timing is a bit unfortunate in that we actually have just hired a new DFC grant coordinator who will help lead the Shared Future Coalition, Crystal Sully. But this is about her second day on the job, and so she has been pulled into quite a bit of orientation and training. So I'm going to share kind of an overview, and then I also have some contact information for her on the last slide as well, if there's some follow-up. And one moment here. Let's see. So I just wanted to share a quick overview of our coalition. We represent community leaders across sectors. That includes business, education, law enforcement, parents, youth, among others. But really the shared mission is around reducing youth substance misuse, which I've provided our mission statement there. We have a geographic footprint of Deschutes County. And we've been around for quite some time. So our community coalition actually originated in 2012, but with a focus on preventing binge drinking among youth. And we've since expanded to include underage tobacco and marijuana use, and even strategic in integrating around problem gambling prevention. Let me just check. Okay, and so our primary funding stream is the federal Drug-Free Communities grant, and we're actually in year 9 out of 10 years of possible federal funding. So we're approaching our federal grant sunset, but we have already secured a grant through the Central Oregon Health Council, an opportunity grant, as it was called, to extend that timeline an additional year behind after our 2025 federal grant sunset. I did want to highlight some of our different community partners that we engage most closely with. So this list here is just the organizations and sectors represented by our current coalition advisory board. But the intent here really is building that community capacity to effectively do youth substance misuse prevention, and do that as a cross-sector group of community leaders that are really in a position to make some of the large-scale changes needed to do, that prevention work, as I mentioned. Our approach is really grounded in the strategic prevention framework, and that helps us move from assessment of our local conditions, which includes our community needs and resources, through implementation and evaluation of our efforts. All of that happening with sustainability and cultural competence at the core of the work that we do, and continuous improvement. We do evaluate our work at several levels. So that certainly happens at the programmatic level, based on specific initiatives that we introduce. But it also means keeping an eye on what we see as kind of our core measures. So that includes youth past 30-day use as reported through our student health surveys, youth perception of the risk of harm from using substances, perception of parental disapproval of use, and perception of peer disapproval of use, just to highlight some of those community indicators that, as I mentioned, come from our student health survey. I also wanted to highlight that our work in this area is really focused on working comprehensively. So recognizing that substance misuse is a complex issue and really requires multiple strategies being implemented at once to tackle. That means using all the types of tools that I have highlighted here, with our upper 4 approaches, so those in the purple text really being what we consider environmental strategies, whereas our lower 3 strategies with the brown text being more of the targeted individual strategies, meaning that they're generally limited to smaller subgroups of the population. And again, as I mentioned, we really strive to be working across all of these areas, and really with kind of synergy between these strategies that they're able to support each other. So an example would be, if we were running an awareness campaign to notify the public about a policy change or change in enforcement, we would look to see how a training might be provided for school administrators, or how we might support that with education or skill building. I just wanted to highlight as well our current projects that we have going. So we do work around the policy, education, and monitoring space, drawing from the expertise and perspectives of folks on our coalition to help us in that education and informing, especially when we see policies come up that have potential impact on youth substance use. I also wanted to highlight local protocols. So our Shared Future Coalition was actually the start of a strong partnership with Ben Lapine Schools in us supporting student policy violation protocol related to how students who are intervened and have violated the school policy related to substances, how that protocol happens. And while that formerly would have been an out-of-school suspension, we've been able to, through strong partnership and capacity, move towards supporting our schools with evidence-based curriculum, helping increase access to treatment in these cases, and partner in some change in how that's handled. I will say too, this is really what we look to as a model for sustainability when we do our coalition work, in that school discipline protocol change has become more sustainable. It has shared support between the school district and state prevention dollars and our county. So that's one example of our current work. We also have a awareness campaign going that several of you may have seen, called Start the Conversation. And it's running on several media platforms in Deschutes County, really with an aim of empowering parents to have effective prevention conversations with their kids, highlighting the importance of early and often conversations, and directing them to our coalition website that has vetted resources to support this. We have seen investment in this campaign by both the Oregon Department of Transportation and also our own Deschutes County Cannabis Advisory Panel. And along that line too, we have also in the past been able to provide Parent Connect workshops, which are more in-depth sessions to provide local parents with skills, support in the area of preventing substance use among their kids. We are seeing some shifts away from workshop registration for both our English and Spanish dominant parents in this area. So one of the things that we are launching at the moment is a deeper dive assessment amongst our local parents to help us prioritize what the methods are of engaging with parents, what those priority topics are in this area, and how are local parents getting their information related to these types of subjects, and how can we really plug into that? We are going to be targeting both our Spanish dominant and English parents to understand how those may be different or shared in terms of the messaging, the platforms, and the methods of engagement. So that's work that we're just diving into at the moment. And then I also wanted to highlight that our coalition has a youth committee and that recruits local high school students to work on substance misuse prevention projects among their peers. So we've been able to work with some really passionate, capable high schoolers that are able to speak to their own the local landscape, I would say, around youth substance misuse, and able to support them and provide them with the opportunities to speak to decision makers about what they're seeing, what their concerns are in this area, and how different decisions, access points, policies, et cetera, have a direct impact on them. And finally, I just wanted to highlight a few opportunities in coming before you all today. I would say I just wanted to share a little bit more about our coalitions, that if there are opportunities to coordinate efforts or collaborate in the future, definitely consider this as really a strong community resource of leaders who are passionate and interested in this topic, and really a group that we work together with on how we can be strategic as a community in tackling large-scale changes and prevention efforts around youth substance misuse. We do also have a few vacancies on our coalition advisory board. So, we have a set of sectors identified by our federal funding source to fill, but it also helps us think comprehensively about who needs to be at the table in order for us to make broad community-wide changes. So our open sectors at the moment are around media and communications, faith-based or fraternal organizations, and civic or volunteer sectors. So please be thinking about whether you know someone who may be interested in serving on that advisory board. I would say don't limit yourself to these open sectors. We certainly have folks at the table who don't neatly fit into our federal funding boxes, but bring a lot of community expertise, leadership, and passion on this topic. So I will share out kind of a one-pager on our advisory board vacancy, what that time commitment looks like, what the role and expectations are, that I'll share and have sent out and follow up to this meeting. But just wanted to kind of highlight some different opportunities, maybe where our coalition may overlap with issues or partners or agencies that you all may be interacting with as well. And that's my kind of short, sweet presentation. I did want to put again, Crystal Sully is our newly hired coordinator of our coalition. So I've got her contact info in there as well as my own, and just give some room for maybe questions and thoughts from folks.
Lauren, one of the things I thought maybe to share was how the coalition has had a shared member in the past.
Yeah,
PHAB member that was
absolutely.
on both.
Yep, so we have had somebody serve on both the Public Health Advisory Board and on our Coalition Advisory Board. I think there were a lot of opportunities to have somebody be that kind of go-between of when there were opportunities to overlap. I also know that having shared membership between these two groups was especially effective when we were doing work in that policy space as well, and having somebody who can speak to both this community coalition lens, but also the Public Health Advisory Board, and wearing both of those hats, I think was really helpful as well. Any other questions about the work, the funding, any next steps, or where we're headed as a coalition?
I really appreciate the systemic and kind of holistic work you're doing. I know it's hard to step into that work where you may not see like statistic results in the next couple of years, and just appreciate that you all are taking such a thoughtful and intentional approach to making those changes. I'm just curious, like what you anticipate are going to be the big challenges and opportunities ahead in the next year to 3.
Yeah, I would say that sustainability profile, just recognizing that we are approaching the sunset of our federal funds. Obviously, I'm really pleased that we received the Central Oregon Health Council Opportunity Grant to give us that extra year, particularly as we were advertising for a new coordinator to be able to offer more supported longevity for that position. But I would say really looking at the sustainability profiles that we have models for within the state at the national level, and seeing, you know, what really makes sense for the work that we're doing locally. What do our partners and our coalition, our existing members see as both the, you know, the value that we add to the community, and how can we keep that going with a sustainable profile? So I think that'll be a really big priority, but it's also recognizing that actually in our move from federal funds to Central Oregon Health Council dollars, we are actually also tackling a new age group. So we're incorporating the 18 to 25-year-old demographic and binge drinking prevention. So while we have focused on underage substance misuse prevention more narrowly in the past, I think re-engaging with partners around that particular age group and building the capacity of our coalition to step into that space will also be a really big priority.
So how are you going to extend your services into that 18 to 25 year age group? Because that seems like a pretty vulnerable bunch of folks, especially for the drinking part.
Yeah, I would say a lot of it is, you know, again, part of it is that using that strategic prevention framework. So, you know, building community partnerships to understand what our partners who are working with this demographic hearing, and seeing what are some of their priorities and concerns. What do we have as data for this group? So really setting the stage and understanding from step one, you know, what is the landscape of particularly binge drinking for that demographic, and then how do we partner and leverage resources that we have to work with that group. You know, I would say before we were working with our DFC federal grant funds, we did several years in the past work with that particular demographic as well. So we have some past tools. You know, I would say we have some evidence-based approaches I'm sure that we're going to be able to mobilize, but it is really rebuilding those partnerships and understanding what local data and capacity exists in this space, and then working to build off of that.
All right, well, any other questions, folks? Please don't be shy.
And
So-
feel free to reach out after this meeting too. Like I said, I'll send out kind of a one-pager of our advisory board position, and would definitely welcome your help if you can think of folks who may be a good fit for that.
I was just gonna add, so that's the ask that Lauren shared with us, besides just giving a program update. Also just whether or not either a PHAB member or maybe someone you know might be a good fit for Shared Future Coalition, so. Well, thanks, Lauren.
Yes, thank you very much.
Thank you.
Thank you.
So Rob, I just realized Charity jumped off the call at 1, so now we
And
don't
so
have
did
to,
Sarah.
Oh, she just did.
So-
Wow.
Yeah, so
Okay.
short tenure.
We missed our window.
We did,
Yeah, we had a
but we
few minutes.
can't approve our minutes. And are there any
Well,
other?
sometimes we work like we're 2 people. Doesn't that count?
Yeah,
No.
why not?
Sure.
Colleen, I just have to see the chicks. Can you show us the chicks?
This is gonna be recorded as like public document?
Oh,
Yes, this is live streamed, so
Well.
oh, you can
it'll
do it
look
after.
weird, but-
it's, I'm
Yeah.
sure
People
it's
watching
fine.
this right
Oh,
now.
there they
Lots of
are.
people.
They're so cute.
Okay, great. Thank you.
Sure. At some point, I hope to have a little larger house where the office doesn't have to double as the chick nursery.
Oh my
But
gosh. so
they've been
cute.
my Zoom meeting buddies.
What are
I
you
love it.
doing with them afterwards?
Oh, they're pets. They don't get eaten.
They're going in the backyard?
Yeah.
Oh, okay.
Yes, these will be the most expensive eggs you've ever eaten.
Yeah.
I'll tell you that.
We have chickens and I've grown up with chickens. It's always a fun thing to have. Until they make themselves known in every Zoom meeting while there's 6 inches of snow outside.
Yes.
Um,
And you can gather their eggs
Mhm.
later.
One thing I realized we kind of skipped over in the announcements and updates is just that Dr. Peter Boehm had mentioned to me a few weeks ago that he has like a conflict going on with the PHAB meetings that's going to pretty much last throughout 2024. He wants to stay on board as a member and would like to rejoin in 2024, but basically asked if he could just be excused for 2023. So anyways, I'm still trying to dig into the bylaws to see what we can do for him, but I think we can make an accommodation that, you know, he'll be on a leave of absence. He won't, contribute towards the quorum. And then 2024, we can pick back up. So I'm gonna be running this by legal to make sure that that's okay with our bylaws. Our bylaws are pretty flexible, so I think we can make it work because we would hate to lose him, so.
It's 2025, right? He's rejoining us?
Yes, January 2025.
Okay,
Yeah, I'm sorry, I
Okay.
might have said the wrong
that's
year.
okay.
Yeah, so.
We're all lost.
So. Yeah, so I'm not sure if we have any, you know, our strategic dialogue discussion, we still had reserved. We did some pretty good dialogue with the fees and, Lauren's ask is fairly straightforward. So, yeah, I'm not
Well,
sure.
and Tom, you're going to send out a follow-up communication to us about the fees and
Mhm.
and our input.
Yes, I'll have a follow-up communication, hopefully when I have a better idea of the budget gap, and also we'll be sending out Lauren's information about the Shared Future Coalition. So those are 2 follow-up items.
All right.
I was just gonna mention one thing that Marissa Cummings and Carissa Heineke, I'm sorry if I'm saying their names
Mhm.
wrong.
That's
Um,
good.
with Public Health Emergency Preparedness sent out a really excellent after action report following the winter storm event from January 8th through 16th. And I think in addition to everything that they did as far as like coordination and communication leading up to and during the event, I just loved that report for how comprehensive it was in learning from the participants and kind of like reflecting on what went well and what could be improved. And I'd be interested to hear from them at a future meeting, talking
Sure.
both about that report and how that kind of after action reflection and report could be applied elsewhere. Because it felt like I've never seen something like that in local homeless services. And it just felt like such a strong way to improve future operations.
Yeah, that's definitely something we could have them come present about.
That'd be great.
Yeah. Great.
All right. Well, if there's nothing for further business, thanks everyone for attending. We'll give you an extra 12 minutes to go and snow blow and shovel your driveways and get yourself out of any stuck car situation.
Yeah, it looks beautiful view out my window here.
Yeah, it is. And we'll
Right.
get the snowpack up and have no fires this summer.
Yes, all for it.
All right. Thanks, you guys.
Bye, thank you.
Bye-bye.
Bye.